Good afternoon, everybody. My name is Okorie, and like she said, I'm a junior at the Boston College Connell School of Nursing. I've had the opportunity to volunteer in several different countries, including Jamaica and India, but this summer was very special to me because I got to go back to Africa. I'm Nigerian, but I got to go back to Ghana and volunteer with the Ghana Health and Education Initiative and conduct an independent research project. That's what I'm sharing with you today. So the Ghana Health and Education Initiative is a non-governmental organization in the Western District of Ghana. They offer several local programs, including a health education program for children, but I specifically did the malaria prevention program, and it's astoundingly community-based. What they do is they offer free bed net distribution, subsidized prices, and they involve community health workers in bed net hanging and in-home flip chart education. What this means is that people in the community are going to their homes of their neighbors, their friends, and their family, and they're educating them on why this is important to use bed nets. So my role in this organization was cleaning and coding data for the annual questionnaires. I remember the country director asked, some people believe in possibility, some people believe in probability, and some people believe in determinism. And I was like, well, I believe in possibility. Anything is possible, but I really need the data to back that up to show that this is a problem and before I can believe to imagine what is possible. I had 3 goals when I was in Ghana. I wanted to learn what resources were available for the pregnant women. I wanted to know where they were located, and I wanted to hopefully prove that the more perinatal education you receive, the more likely you are to use a bed net to protect yourself and your child. And I specifically focus on insecticide-treated nets, or ITNs as you see it abbreviated, because these are very accessible, they're very simple, and it's primary prevention. An insecticide-treated bed net reduces malaria mortality rates by 55% in children under 5 years of age. And when they're used by pregnant women, they reduce the occurrence of maternal anemia or low birth weight of the baby or other sorts of complications. I also really focus on antenatal care because that is the first time a pregnant woman gets the education about her baby to ask questions and identify potential complications. So I figured it was the most important time that you begin to educate her on bed nets and why it's important to protect yourself and your child against malaria. The data was collected in 2 weeks in 3 villages, and there were 3 questionnaires: a household questionnaire, a woman questionnaire, and a child questionnaire. I pulled sections from each questionnaire that specifically focused on bed net usage, perinatal care, and I compared it to 2 different sets of statistics. One was the statistics for all of Western District of Ghana, and then one was Ghana in general, the entire country. And it was based off the multiple indicator cluster survey from 2011. And that was a way for the country to evaluate if it was reaching the Millennium Development Goals that you heard about earlier. Before I share my results, I want to give you a little bit of information about malaria and why it is so important. So the picture on the right shows that 7% of all maternal deaths in Ghana are caused by malaria or anemia. And malaria affects 198 million people around the world, but 90% of these cases are in Africa. 78% of these deaths are in children under 5 years old. So you can see that it's the women and the children that are really bearing the brunt of these diseases. These are the most vulnerable populations, and that really stood out to me. And common symptoms of malaria include high fevers and anemia. And like I said earlier, if you are pregnant and you are infected with malaria, you can have organ damage and other poor birth outcomes. The data was collected in 3 villages: Hunjibra, Kojina, and Serrano. So these, as very, I guess, medium-sized populations, 4,500 people in Hunjibra alone, but the majority of people living there identified as Sefwi, and they spoke Twi, and so all the questionnaires were translated into Twi. Most of the adults in the village take advantage of the fertile soil, and they are cocoa farmers, but some of them are also teachers, taxi drivers, and tailors, and these are the people that become community health workers and volunteer to help spread knowledge for their own community. These villages were identified through a community-based process of interviewing district leaders. So we conducted a baseline survey about the malaria burden of the community and why it was important to help these people specifically. So what did I find? When we look at the percentage of people who said they slept under a bed net the night before, we can see that net usage has increased over the past year. There's a difference between the usage in Ghana, and you can see it's 28.6%, and the usage in the 3 villages, which is 68%. And that, I think, is really due to how community-based and continuous the organization has been in involving people of the local community in their education. When we look at the general usage of insecticide-treated nets, we see an upward trend from 2014 in yellow to 2015 in red. But I separated the graph into 2 smaller populations. There's HKS, which is the 3 villages, children under 5 years old, and the pregnant women. And you can see that in 2015, the pregnant women used it 77.1% of the time, and children under 5 use it 68.1% of the time. And this was really the spark for my research, because I didn't understand why it was that a mother would use bed nets more when she was pregnant and not so much after she had the child, because both are vulnerable. You have to keep protecting the child. And I wondered if, when they went to get antenatal care, if they received more education about the importance of using bed nets, and if that frequency really came from that education. And so I looked at antenatal care. The World Health Organization recommends that women attend antenatal care at least 4 times. In the yellow graph, you'll see that across Ghana, at least 95% of women attended antenatal care. Of these women, in black, you'll see that 86.6% went at least 3 times. In my 3 villages, it was 92.8%. And this shows that women are going to the antenatal care resources. This is a very important vehicle for education. I compared that with some data from 2011 because I wanted to see, during this care, what kind of information is being provided about malaria. And so it shows that over 81% of women who attended postnatal care prior to their pregnancy received malaria medication for prevention. In 2 of my 3 villages, Serrano and Kojina, you can see that the percentages are 100% and 91% respectively. And so women are getting medications per prevention, but I didn't understand what kind of education they were receiving. So as a nursing student, we tell them about transmission. For example, no, you can't get malaria from person to person. You can only get it from mosquitoes. But do these nurses educate the women on the ways to make their environment more safe? For example, are they recommending that these women go seek out bed nets? And if they tell them to seek out bed nets, are they referring them to organizations like GHEI? So basically, what is the system around this mother that helps her understand the importance of malaria and give her access to using these bed nets? Finally, I looked at the sources of postnatal care to identify where these women seek education. You can see that 50.2% of women go to their local clinic, another 17.9% go to their local health center, which shows that they're using the resources available in their local community. So we know exactly where this is happening, and we know exactly where the information is coming from, which is very, very powerful. So this led me to 2 big conclusions. First of all, continuous intervention is absolutely critical. You can see the difference between Ghana overall and in these 3 villages because these organizations have been so invested in their local community. Second of all, we can see that it's not that people aren't using the resources available, we just don't know what kind of information they're getting back, and we don't know what kind of information is being given to them. So, for example, I showed that how often women seek antenatal care, but we don't know what they're being taught. And what surprised me is that the organization I was working with didn't know either. They don't have any data about what was being taught. And that is a really big gap because when as a nurse, we're taught to focus on one person. You give individual education. It's very important that you learn to talk to a person one-on-one. But at the same time, you have to realize that this person is part of a holistic system. You have to understand everything that plays into their care. And I think that led me to my policy implication if I had the power to create. I do have the power to create a policy someday. We have to strengthen the partnership between government organizations and local centers like clinics. There's no reason why each one shouldn't know what the other one is doing because at the end of the day, they are treating the same disease in the same population. Some other factors that I didn't have the ability to explore, but I would love to explore, are things like, doesn't matter how many years of education you've had, doesn't matter how close you are to a clinic, or doesn't matter how expensive it is to get a bed net, or how expensive healthcare is. Some interesting observation that I made is that in the bed net usage, the people who do own bed nets don't use them 100% of the time. So what is this gap? Why is it that when you do own the bed net, only 48.1% of people in Ghana actually use them if it's right there in the house? So those are some things that I found very, very interesting. But overall, this was very empowering for me because I can see the dual-sided role of nursing. I understand malaria and I understand prenatal care, but I can see how we can take it to a bigger scale someday and empower a whole population full of people. This also helped me understand the process of context. It's one thing to ask a question about why aren't these women using bed nets, but it's another thing to consider the systems available to them and the resources that they can provide. And in summary, I am very grateful to GHEI for providing me with this opportunity to kind of take my volunteer experience a step further and present what I've learned. I see myself continuing to travel. I hope to get an MPH and work in maternal health, hopefully in my home country of Nigeria. And I'm really grateful that you listened to me and could share this with you. Thank you.